Now let's talk about what happens a little bit once people finally get this diagnosis after this long journey just to even get a clear answer. I'm so curious. Once a patient is diagnosed, what is typically the first couple of steps they should expect when it comes to treatment and forward motion? And either one of you could answer that question.
Go ahead, Dr. Siri. Why don't you start and then I can fill in?
Okay, super. So once we basically have the suspicion, we diagnose a patient, they have this, mutation that we know, or even if, they're one of those rare patients that we don't think that necessarily has that mutation, perhaps there are other things in their clinical picture that suspects mastocytosis, such as persistently elevated tryptase or recurrent anaphylaxis, but we really strongly suspect the patient. Most patients, pathologically, we kind of need that diagnosis, so we usually send them to a hematologist oncologist for a bone marrow biopsy. Does every patient need to have a bone marrow biopsy? No, but I think most patients want to know, especially if, the mast cells are invading their bone marrow and it's causing a lot of problems. I think you have to kind of classify how bad is this going to be. And so most patients will go to a hematologist oncologist. They will get a bone marrow biopsy. They'll have the testing also repeated on the bone marrow. And then we can move forward from there. Before we talk about other treatments and journeys, do you want to add to that, Jessica?
No, I think that's right. I think sometimes patients are a little nervous about getting the bone marrow biopsy, but it really is clinically important because it helps the doctors to determine, first of all, to confirm the diagnosis of systemic mastocytosis and also to see if there is a different variant of mastocytosis that you have. So, in order to kind of get down to the specificity of which variant of systemic mastocytosis you have, the physician needs that bone marrow biopsy. So, it's important that even though it might be a little nerve wracking for patients, there is a reason why your physician is encouraging you to take the step of getting the bone marrow biopsy.
You mentioned a little bit, Dr. Sear, about genetics, right? When you look at patients, talk to me a little bit about how genetics plays a factor. Is this something that multiple people who share the same genetics are likely to have? Is it the mutation that happens over time, something that lays dormant? How do you talk to people about that?
Yeah, I think that the genes is a fascinating topic. And so I think when we say genetics, oftentimes people think, oh, it's something I inherited from someone else. But this is actually a somatic mutation, which means that you acquire it in your life. Most people, it's not because they inherited from a parent. Most people, they acquired it in their life. Just like we think of, some genetic cancers, like you weren't born with this and now you're 62 and, you developed something in your bone marrow that just decided to grow. So this is not something typically that's inherited. There are some rare cases, of course, where it is known to be inherited, but those are exceedingly rare. Most of the time, it basically is something that you have acquired in your life, which is why, it could be somebody who's 2 or somebody who's 12 or somebody who's 54. And so it can be quite variable. So that's what we mean in terms of that genetic mutation. There are other symptoms that go along with mast cell light pictures that can be inherited. And we can talk about the different buckets of mast cell disease, which I love talking about the different buckets. But specific to systemic mastocytosis, that is a specific genetic mutation that, again, is a turn on switch. And again, they've acquired that in their lifetime. And then once they have a great diagnosis of how invasive it is, the different kinds that Jessica talked about, then we can talk about moving on to treatment. So those patients who have kind of indolent systemic mastocytosis or smoldering mastocytosis, it's really impactful to them. However, it's not to the point where it has invaded so severely, then it could be treated by multiple doctors. Sometimes the allergist immunologist treats them. Sometimes a hematologist oncologist treats them. And typically we try to target the mast cell to decrease that burden of mast cells with newer medications that we now have that reduce mast cell burden. And on top of that, we will use other medications that help with symptoms, such as antihistamines or mast cell stabilizers or medications over the counter that help with symptom relief. And of course, if the patients are having a lot of anaphylaxis, we have to talk about things such as epinephrine autoinjector just to keep them safe in case there's like bad anaphylaxis, things like that. So those are usually the next steps for somebody with smoldering or indolent systemic mastocytosis, where it's there, it's burdensome to them, but maybe not to the point where hematologist oncologist will intervene. And that would include medications to kind of stabilize the mast cell, medications over the counter to help with symptoms, but mostly now with newer medications that we have available that target the mast cell and reduce mast cell burden and keep them from replicating or reproducing so much.